calling 911 and only one firefighter arrives. In life-saving professions, there are rules about staffing, except in our hospitals. That's why the nurses and healthcare workers of SEIU Healthcare 1199 Northwest are working to make sure there are enough.
A basic issue for culture of safety is adequate staffing.
If you're taking care of, for example, in postpartum, 5 mother-baby couplets, the baby is also a patient. It's just too much. Errors are made.
This system and these tools will help every nurse start to solve the problems and fix the processes so that they will be able to have the time they want to give quality patient care.
As a manager, I've been doing this for now 15 years or so. I think it's a great opportunity to bring nurses and the management team together.
Have a better understanding of what management's doing. Hopefully, in management, we'll have a better understanding of what we're doing. And as a team, we can better serve our patients, be more efficient, be more effective, and be safer for the people that we take care of.
Oh, I work in public health, and I have no fame or wealth. But when I go home, I sleep good every night. I help the people that I serve, try and get what they deserve. They depend on their only creation.
This is a way to give a message to St. Rose that we're not going to allow you to mistreat us.
Safety is priority number one. Then a new world full of justice will truly have begun. But to date, that is a task that is so far left undone. For the union makes us safe. Solidarity forever. Solidarity forever. Solidarity forever.
These are very unique and wonderful people that suffered large devastation about a year ago. They're still trying to recover from that, and we are coming to seek your assistance in helping them to recover faster.
Es importante para todos que sepan la necesidad que tiene Haití en este momento de ayuda. Ya pasó el earthquake, ya pasó el terremoto. Ahora hay que levantar este pueblo. Este pueblo necesita ayuda. Este pueblo necesita de ti, necesita de mí.
When they learn these techniques and these procedures, that they can be self-sustaining and not have the U.S. standing here holding their hand, they can in turn support themselves.
We have a number of volunteers that are here that are helping to help these people recover And as Americans, this is what we do. As nurses, this is what we do. As healthcare workers, this is what we do.
We're here today in a celebration for a ban on mandatory overtime. We've worked hard towards this legislation, and it's going to be so important for the safety of our patients.
I'm excited about this bill. That means my employer cannot ask me to work overtime the last minute, and I'm excited I can go home and enjoy the time with my family.
We're glad that the situation can be safer for our patients and our nurses all across the state, whether it's in a hospital or a nursing home or any other kind of healthcare facility. It's been a long fight.
So what do we want? Contract! When do we want it? Now! So what do we want? Contract! When do we want it? Now! No contract? No peace! No contract? No peace!
A few hundred nurses from across the state marched on the Capitol this morning like they have for the last dozen or more years. They want lawmakers to pass House Bill 147, which would set a minimum safe nurse-to-patient ratio in all Pennsylvania hospitals. They say hundreds of lives could be saved each year if nurses are able to spend more time with acute care patients and not be burdened with more patients than they can care for.
It's common sense that when we have fewer numbers of patients to care for, we can provide higher quality care. A nurse running from patient to patient will miss the subtle clues that can indicate a problem that become a serious complication.
I'm very concerned with the budget cuts at the state and federal level. These cuts directly affect my patients and how I care for them. We need to do something now. Otherwise, it's just going to continue to get worse.
This is a grassroots effort. There's a lot more work that needs to happen in Wisconsin.
When a patient comes through the door, it's my job to give them the attention they need so that they can heal. But these days, my job is more difficult because of increased patient loads and not enough nurses. But Senate Bill 5 makes it harder for nurses to give the patients the quality care they need.
Today, nurses and doctors and healthcare workers from across the country are all presenting scrubs that they signed over the course of the last month or so to give a personal message to Congress about why we need healthcare reform now.
Every day nurses pick up scrubs similar to the ones that are hanging. They put them on and they go about doing their work to help take care of our sick and frail citizens. But this time we know that that is not enough. We have to do more.
And who think that every patient matters is more than a slogan. It is a mission that brings us to work every day, and we want Congress to act now.
One of the things we want to make sure is that nurses are represented in the healthcare reform committees because we want to be there on behalf of our fellow nurses and on behalf of the patients that we sometimes have to speak up for.
I guarantee you nurses were part of the Healthcare Summit, and they will be at the table in all these discussions. I'm biased towards nurses. I just like nurses.